Good afternoon, ladies and gentlemen. I know we're the last panel of the day, and I think, Omar, we have saved the best for last. But before we get into the panel, I just want everyone to do one thing. Can you all stand up for me? Everybody stand up. Yeah, everybody stand up. I want everyone to take a big, deep breath and stretch it out. Yep, if you can wiggle it, do it as well. Do it as well. Get some energy in you. We've got a fantastic panel. Everybody take a seat. We're so excited to have you with us for this, the finale for the summit, which is really brilliant and really exciting, talking the future of healthcare. Is it in the home? And we think it is. So I would love to begin with you, Dr. Noura. Let's jump straight into the discussion and talk to us about how Ambulatory Health Services, AHS, was established and what was the vision behind it in launching these mobile health services?
So, good afternoon. Assalamu alaikum. This is Dr. Noura Ghaithi, AHS CEO. Thank you for the opportunity to be with you and to be part of the advisory council. Thank you, Shaista and Pure Health Group. So proud to be on this amazing event. So, Ambulatory Healthcare Services, AHS, it is a Saha asset, healthcare center, healthcare facility, and we are proudly under Pure Health Group. It was launched in 2008 to facilitate the provision of a curative, diagnostic, and the preventive wide scope of service. With time and from year to year, we grow from a few small clinics treated simple medical condition, acute conditions, to 55 multi-speciality centers and bigger scope closer to the community through our visa screening centers, for example, where we are the main provider for such screening and fitness service. And we are closer even to the community through our 200 school health clinics and public school. And we have in AHS state-of-art different mobile clinic solutions. And with years also, we believe that in Saha and AHS and under Pure Health that we are growing in digital maturity. So we are there strongly with electronic medical records, with portal, and with different solutions and systems supporting the quality and value of our service to our customers and patients. And here is where AHS started.
And so, you know, post-COVID, lots of services have moved from the clinics, from the hospitals to the home. So talk to us about how you do that, how you provide specialized services to people in the comfort of their own homes while still maintaining the same high level of quality and safety.
So we are doing it in a hybrid way. We have the combination of being there physically for our patients. And this is through our mobile teams and home care services whenever it's needed to be physically there. And this is what we saw during COVID actually, and I am confident to say that we learned from COVID that more than 50% of our patients who used to visit our centers, they could be easily managed in their home, in the comfort of their home actually. The other part, which is technology, and here where the colleagues yesterday and even today said COVID accelerated the adoption of technology, and COVID really, it is the chief transformational officer. So we have the teleconsultation, telehealth, where we could easily continue the service and affordable the treatment and consultation for our patients. And from the other side, I should mention the best experience during COVID, which is the patient monitoring. So our teams were able to shift the treatment and assessment to patient home, not only for vulnerable patient, chronic disease patient, or people of determination. Different scenarios came all the way during COVID. So we were there to support them with the treatment, and we were following their recovery. And this is through the remote monitoring, where the healthcare provider and the other side were on top of the vitals, any progress in the patient condition, and immediately they took decisions or action where it saved life. The last one may be, as again, chronic disease. It is a topic of importance, especially for a primary care network like HS. So the systems, tools, apps, solutions that diabetic patient or chronic disease patient use is very important to keep them engaged and on top of their treatment or disease management. And the data that we are getting today from these apps, it is very valuable for discussion between the patient and the provider. Again, I think the healthcare operators who are here, they noticed that their portals, for example, it was highly used during COVID. People, they didn't use the portal to get their result, certificate, appointment, to be even independent, how to access their health, like how it is in COVID, and we are lucky really to have it post-COVID. I'm sure if we introduce telehealth before COVID, it won't be with that positive impact we have it, and we continue to have it post-COVID.
Fantastic. And so, Ehab, if I can come to you now to talk to us about how digital and remote healthcare technologies are, in fact, enabling earlier, better, and faster diagnosis and treatment for more people in need.
Thank you very much, and thank you for the invitation and the great event. I'm really glad to be here with you. Just to put things in perspective before coming back to your question, the spend globally in healthcare today is about $10 trillion. That makes healthcare really one of the biggest and the fastest growing industry globally. And of course, digital plays a big role in the modernization of healthcare systems. So today, about $100 billion goes into digital solutions, digital technologies. So the technologies that Doctor talked about, these technologies were there because the opportunity was there, because the funds were there, and companies and SMEs and companies like GE were interested, to tackle that challenge of how can I transform healthcare, how can I get into digital transformation. So that brings us into a lot of technologies, because digital healthcare is really such a broad concept. Under that concept goes AI application, machine learning, algorithms. You talk about telehealth, you talk about telemedicine, where you have teleradiology, ICUs. You're talking about data warehousing, how to deal with data. You talk about connectivity. You're talking about wearable devices. You talk about connected wearable devices. There's such, a huge concept behind digital, and there are so many stakeholders, so many companies are involved in today in making it happen. So each in his segment working. But that also creates a challenge, because when you have so many companies working with so many applications, you need someone to validate those solutions, and you need to integrate these solutions together. In order to provide the great services like AHS are providing, a lot of work has to be done in the background, from data warehousing to connectivity to cybersecurity to integration to workflow integration. The last thing that we want to do is really to add more work to the doctors, and technology comes with a lot of work and a lot of learning curve. So we wanted really the technology to be seamlessly integrated. We don't want anything to add to the time of the physicians, today. And without achieving that, in collaboration with companies, in collaboration with end users, without doing that, we will fail, we'll all fail, because it will be cumbersome and it will not work. So technology needs to be seamless. It needs to add, to the physician. It needs to be sustainable. It needs to be upgradable, and it needs to be through a collaboration between the end users, the providers, and the different companies. And no one company can do it alone, and that requires a lot of things that we need to work on together.
It is quite an ecosystem that needs to happen, all needs to work together for it to work well. And so I'd love to bring you, Milton, into the discussion now in terms of, being the founder and CEO of VSee. Talk to us about how VSee fits into that ecosystem, what you're providing to your end users.
Yeah, thanks. By the way, super honored to be here. So the basic problem we're solving is if you go to a conference like this, right, the CEOs will get on stage, talk about how amazing all the digital transformation they're doing. But if you were to go to talk to the physician, the nursing in their hospital behind closed door, they're going to say they're extremely frustrated. The reason it's frustrated is it's very difficult to create a solution that customized to exactly what they need to do. It's almost like clinicians feel that sense of helplessness, right? Here's some IT made some decision. Now I'm forced to use this thing. My productivity actually just decreased by 30%. By the way, you see the statistic across all the healthcare industries in US and so on. So what we do is, our vision is that I want to empower the clinicians to create their digital health solutions with no programming. Right? Today, if you think about, I want to create a digital health, I think about hiring programmers doing this. What if you could do it with no programmer at all? You can just simple user interface to control this. So we believe ultimately this will allow truly empower the clinicians to get exactly what they want. You don't need to ask anyone permission, create the workflow you want, make yourself superhuman in terms of productivity. Then we think that's the basis, then you could truly make all these things people talk about, not just on conferences, but into everyday reality.
Making it more accessible, making it customizable, all of these things are really critical.
I think the key thing is about empower the clinicians to do the creative workflow without hiring a programmer.
Yeah.
Because soon as you have to hire a programmer, become IT budget, right? All these things. Next thing you think is 9 months later, it's like, what's going on?
Yep, it's too expensive, it's too difficult, too complicated. Dr. Erik, if I can bring you in on this, talk to us about the latest scientific innovations and technologies that are in fact allowing us to create effective mechanisms for remote patient diagnosis, care, and monitoring as well.
Yeah, thank you. Thank you for the question, Sally. And I think it's kind of a summary question of what we've learned over the last two days, really. We've heard about whole genome sequencing, we've heard about precision medicine, we've heard about wearables, rings that you can wear that measure anything, different biomarkers that you can screen for, and predictive algorithms behind it as well. So we heard the whole gamut, I think, but I think what it comes down to, in my opinion, really, is that we want to get to a stage where you have a digital version of yourself, which kind of alerts you, which helps you, which nurtures you, which helps you to optimize your health. I think gone are the days where, we all go to hospital only when it really is almost too late, right? When you look at curative health or acute health or chronic disease management, where what we're really looking at now is a stage where it becomes more and more important for people to optimize their health right from the beginning, using all the tools and techniques and new technologies, new innovations that we've heard about, and helping people really to get their version of what's needed. Not just what, everybody gets prescribed the same thing at the same time because it help a certain number of people. It will be more precise, more predictive, more personalized, and also more participatory, which is really where the home matters, right? We all go to clinics on a regular basis, get our lab results sent to us. But how often do we actually think, well, do we actually participate in our own health? Do we actually become part of it? We often kind of read it as a one-way stream, right? And it's not good for us and not good for our systems. And I think that's really where the latest innovation comes together, where you get a lot of these innovative solutions that we've talked about today coming together into a more predictive format, where you get a personalized healthcare, a digital version of yourself, like call it your digital twin or your twin, your best friend, your extension of yourself.
Your digital twin that you kind of get to look at separately, but it's also still you and motivates you to be better. Yeah. I think when we look, I think all of us have these metrics in our phones that say you've looked at your phone for 3 hours a day, or it's gone up or down or whatever, right? I think a lot of the apps that we look at, we don't understand fully the value of it.
Once you start to understand the value, and you actually alert you to walk more, to exercise more, to eat healthier, to be more engaged with your own healthcare, I think the more you get those prompts, and it's an AI-enabled, a machine learning-enabled algorithm behind it, actually helps you. And it also understands you, like, there are people like me who were treated like this, but who get the outcomes like this as well. So that whole kind of real-world evidence in terms of a personalized way, I think that's where the future is. Now, what that actually looks like, and if it's an integration of different apps or an integration of different wearables, I think it's a combination of all of the above.
It is, absolutely. And so, Dr. Noura, as well, let's talk about that from your perspective too, in terms of the cutting-edge technologies that you're looking at that really play a critical role in enhancing patient care and providing easier access to services.
So let me talk about how we should target the population that really in need for such service. So we are building our approach and the plans based on the fact that we have today. So majority of us actually are busy, and we are neglecting or ignoring maybe the medical needs for ourselves. Busy parents, even they are not paying attention for their kids' need. The other part, which is the population is aging. So we have a good percentage of our population aging, and we have senior citizens that we need to pay attention and to make their health care tailored for them accordingly. The other thing which today we have is a huge data from the healthcare system, and population management data were supported us to have this risk stratification and who we should approach first. And the patient expectation and experience that we heard about during the summit, during these 2 days, and accordingly we should provide personalized, preventive and predictive service for this population. I believe the digital part of healthcare is evolving, as by evidence we saw it before COVID, during COVID, and nowadays. But as the colleague said, we should engage strongly the patient and the care provider, because these who will play the role in making these tools successful for the best outcomes, from wearables, from teleconsultation, remote monitoring, for different tools and resources. And I think we did a lot, and still we have to do a lot with partnership and collaboration, especially with the maybe startups. And this is a room that we are opening today. We have the pool of patients that we need to support them with such innovative ideas to prove the concept of such tools and really to be utilized. It should be cost effective, and I should say it today, because the patient want to use it. Not only the sophisticated healthcare provider, they could get it, even every single healthcare provider should have it. So the cost of these tools and solutions should be affordable, to have affordable, continuous and coordinated healthcare system and approach to our population and patients.
Affordability is key, and that's kind of a little bit of a call out to startups who are thinking in this space as well, which is really exciting. But Ehab, sustainability is really key here. So how are you supporting healthcare providers and givers to deliver responsive, timely and compliant care while reducing carbon footprint?
This is really a very interesting question. And I think people might not get what sustainability in healthcare is, because we were thinking most of the time of patient and quality of care, and not necessarily sustainability and what healthcare system is really doing to Mother Earth. How much healthcare system is contributing to the carbon footprint globally. We have a responsibility as a manufacturer in GE. So when we have responsibility, GE Healthcare in specific, that our factories need to really meet a limit, etc. But also we have responsibility in the way we manufacture our equipment. And today, for example, the latest the MRI machine that we launched at the RCNA in Chicago, is consuming 25% less electricity. So most of our equipment that we are producing, are trying our best to innovate in a way that it consumes less and less energy, which is positively impacting the carbon footprint. But not only that, when we innovate as a company, sorry, I'm talking about GE again. So as a company, when we innovate in technology, in digital technology, means that maybe keeping only the sick people to come to, the more ill people to come to the hospital, and less people stay at home. When we keep doing that, and more remote monitoring and more, remote diagnosis coming, so less people will travel and use the cars. And we did a study actually on how much that would equate to in terms of pollution. So yes, we are in healthcare, but also we care about Mother Earth, and we have our responsibility as a company to innovate, technologies that reduce footprint, and technologies that can help our provider to meet their targets, because this is becoming interestingly more requested nowadays. There are projects in UAE at DHA, for example, that looks into how much of consumption these medical equipment are having, and what solutions are there to replace these technologies with technologies that consumes less energy. So there's a drive, and I know this is a strange topic, but it is coming, and it's coming more and more in this part of the world. Thank you for that really great question.
Of course. Milton, if I can ask you about the challenges for remote care. It's not without its challenges, but also what are the opportunities for AI and augmented reality in enhancing remote care too?
Yeah, I would say like as soon as you do home care, right, you have all these sensor data, all these, like could you hire any physician or nurse who just want to review the data, right? I'll say that's probably the most boring job you could possibly think of. So I don't think people will actually do this. So having AI to process the data, to elevate to the clinician to take interaction, I think is not just nice to have, it's must have. If you don't have that, you will not work, right? So this is that fundamental. When you talk about augmented reality, it's a direct opposite. I will venture 99% of augmented reality projects will fail, right? They miss the fundamental problem is, like whenever, if you think about your loved ones, right, the first time they put on one of those glasses, they will say, it's amazing, right? They will tell you how amazing it is. But watch them. Will they put that glass again a second time? No. Because fundamentally, it does not create enough value to create this, right? This is, again, one of the classics of part of my background is my PhD at Stanford was in the Stanford Design School, so we focus on watching people. So again, you don't ask how much they love about augmented reality, just watch what they do. Again, they don't use it. This again, so AI, awesome, augmented reality, complete failure.
See, that's really interesting because, there's so much, there can be so much hype around it and people are like, oh, this is it. But actually, that's a very kind of realistic way of looking at it. What do you need in that area to enhance it though?
Well, I think there are definitely applications for augmented reality. In fact, when I went to my graduate school, I wrote my dissertation around that, right? I did a bunch of research over the last. So outside the specialized application, the general space, like the Facebook, the metaverse, right? It's just fundamentally, it doesn't work. In the sense that you don't want to put this 2-pound thing on your head. Yeah. It's hot, can make you sick after a while, right? It just doesn't add enough value in there, right? This is, again, doesn't matter how much hype you have, it does not trump physical, biological processes, right? Yeah. Just think about how many you willing to put this thing on your head for more than a couple minutes in there. How many of you willing to do this? Have you seen other people do it? Right? Again, also the gamer that you don't, right? This against the biology trumps hype.
Yes, exactly. And so, Dr. Erik, let's ask about trust. This is very important here in terms of, what are the strategies, particularly that healthcare professionals and service providers need to implement to have enhanced patient trust and reliance and satisfaction when we are talking about contactless and remote care?
Yeah, good question. Like, I think it's two things. One thing I've observed is over the last 2 days is that even though we talk about home care and bringing people personalized care and precision care, what we haven't really talked about is how that can happen in a hybrid format. It was actually the previous panel was talking about the hybrid, but the hybrid from a form of where the hospitals can actually show a version of your home. And that's where the trust comes in. If you have a trusted physician or a nurse or a technician or a person working in a healthcare facility who can actually show you, this is what your home will look like. This is what you can trust. You can hear it from the person. You can see it. They will trust it then to bring it to their own place and actually implement it then. I think a lot of the obstacles that we see is obstacles that we've created ourselves, that we need to teach people, need to put more education in terms of and teach people how to kind of get the best version out of themselves, how to optimize their health using the technology, but technology not to be all and end all. I think technology is an enabler. It's us as people, who can show, well, this is what your home looks like, and this is what your new home will look like. We will enable you to live there and to optimize your health, to get the best out of your health. But this is what we can do. And this is kind of something that hasn't really been done that much in the world. We've talked about remote monitoring, which is the other way, you know. But I think showing people on a day-to-day basis, this is what, and some of that is quite low tech. But that's where I think some of the start will come from.
Fantastic. Does anybody have questions for our panel as we are running out of time? Yes, there's a question over here. Yep.
Can you raise your hand, please, whoever has a question?
Bismillah. Thank you for this interesting panelist. I will not say my question is addressed to whom, but he will know himself. What is GE Healthcare focus in the next 3 to 5 years in the Middle East? Is it around the healthcare equipment or it will be beyond that? Thank you.
Just, can you repeat the question at the beginning? I couldn't.
What's your strategy or focus? Strategy or focus in the Middle East as your region in the healthcare itself? Is it dealing with the equipment only, or you have another initiatives or project going into this region? Thank you.
So thank you very much. You know, I hope I got the question correctly, but just our strategy in general for the region is partnership. You know, so we need to partner with healthcare provider, you know, to deliver best healthcare, enable them to deliver best healthcare. So having said that, you know, so how do we do that? So we need to align with your own strategy. If the strategy of healthcare, for example, let me talk about a country like Iraq. So if the strategy of healthcare is still basic, they need to really build from scratch in ICUs, oncology services, etc. How can we enable them to do that? So one of the projects we did in Iraq, for example, is to enable them to build 22 in ICU project to become a gold standard in ICU and then elevate really or reduce the mortality rate. Each of these in ICUs will come with a lot of equipment inside, but also importantly will come connected digitally and including training of the physician, training of the provider in healthcare. Same for oncology. We're building 19 centers of oncology for the same thing. This was not possible in a country like Iraq. If we talk about other countries like UAE, we're working with the authorities in the UAE to help them really digitally transform. And when we say digitally transforms, okay, we have project with the Mohab, for example, with teleradiology. We are connecting 16 hospitals and 60 clinics, through our digital solutions. And no matter where the patient is being scanned, he will be his report will come in a very short period of time by dedicated physician who might be sitting anywhere else in the UAE. This is a project that we work on for the last maybe 4 or 5 years and improved healthcare services big time. So how do we come with these strategies? Is by aligning and by looking at the needs of our customers. And we would love always our customers to look at GE as a consultant in helping them achieving their goals and their strategies. We don't like to be just looked at as an equipment provider buy-sell model. So we build partnerships, we build strategies, and we build strategies aligned with our customers in the region, with providers, whether it's government or private. And also we are a big part in bringing PPP's project to life in the region. We have done it in Turkey, we're doing it in Saudi, we're doing it here, and that big part. So the name GE, when we work within a consortium, helps big time to get funding, get interest from investors to come and invest in healthcare. All that cannot be done alone. All that needs flexibility from an acceptance from our customers and working on a partnership. And that's the only way that it succeeds. I hope that answers your question. Thank you.
So basically the answer is a lot is coming. Thank you so much for that.
Marketing, sorry.
No, listen, I tell you what, this is such an incredible panel. I know we have other questions. There is so much more to learn from these incredible speakers. Please do connect with them after this session. Ladies and gentlemen, please join me in thanking our fantastic speakers. And thank you all so much for being here for our final panel. Thank you.